Nervous system disorder, structural disorders such as brain or spinal cord, or other nerves can result in a range of symptoms. Most common nervous system disorder is stroke. Is a sudden interruption in the blood supply of the brain. This is the disease affect the arteries leading to and within the brain. It occurs when a blood vessel that carries oxygen and nutrient to the brain either blocked by a clot. This is also called a brain attack or cerebrovascular accident. There are types of stroke. First is ischemic. The most common type of stroke is caused by a clot or other blockage within an artery leading to the brain. The brain depends on its arteries to bring fresh blood from the heart and lungs. The blood carries oxygen and nutrients to the brain and takes away carbon dioxide and cellular waste. If the artery is blocked, the brain cells cannot make enough energy and will eventually stop working. If the artery remains blocked for more than a few minutes, the brain cells may die. The most common problem is narrowing of the arteries in the head or neck. This is the most often caused by gradual cholesterol deposition. If the arteries become too narrow, blood cells may collect and form blood clots. These blood clots can block the artery where they are formed, become trapped in the artery closer to the brain. Second type is hemorrhagic stroke. Is when blood from an artery begins, or is a when blood from an artery begins bleeding into the brain. This happens when a weakened blood vessel bursts and bleeds into the surrounding brain. Pressure from the leakage block damage brain cells. As a result, the damaged area is unable to function properly. There are two main causes. First is intracerebral hemorrhage. The bleeding occurs inside the brain, and subarachnoid hemorrhage. The bleeding occurs between the brain and the membranes that cover it. Both types of hemorrhagic stroke have a conventional stroke risk factor. They have different factors that for having a stroke. First is high blood. Blood vessel damage by high blood pressure can narrow, rupture, or leak. High blood pressure can also cause blood clot to form in the arteries leading to the brain, blocking blood flow and potentially causing a stroke. Next is cigarette smoking, exposed to secondhand smoke. This increases the risk for stroke by 20 to 30%. Each year, secondhand smoke exposure causes more than 8,000 deaths from stroke. Even briefly breathing secondhand smoke can damage the lining of the vessel and cause your blood to become thicker. Next is heart disease and diabetes. High blood glucose from diabetes can damage your blood vessels and the nerves that control your hearts and blood vessels. The longer you have diabetes, the higher the chances that you will develop a heart disease. Next is transient ischemic attack. Often is a buildup of cholesterol-containing fatty. Typically happen because a blood clot gets lodged in an artery that supplies blood to the brain. Without regular blood flow, your brain is starved for oxygen and can't work like it normally does. Age 55 and older. As cardiovascular and metabolic disease increase rising with age, older people are more likely to experience strokes. Age is the single most important risk factor for stroke. For each successive 10 years after age 55, the stroke rate more than doubles in both men and women. Being overweight. Because of excess fat in the body, inflammation is likely to occur, which causes poor blood flow and potential blockage. Lack of physical activity. Researchers believe experience reduce the risk of stroke by lowering blood pressure as well as by improving blood vessel functioning. Signs and symptoms: sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. Next is sudden confusion, trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden severe headache with no unknown. FAST. This is a treatment for stroke. F stands for a face. So if we saw a person, the face is uneven. Arm stands arm when one arm hanging down, and the S stands for speak. If the person it's hard to speak because of an uneven face, we have to call an emergency so that we can save the person for the worst. Also, they have stroke with we have the treatments. First is medications. Normally, a person having a stroke are having the medication or maintenance. Next, they can do the surgery, rehabilitations. This one is help makes a stroke person to help stroke survivors learn skills that are lost when part of the brain is damaged. Aspiration precaution, we have to teach or we have to inform a stroke patient that they can eat in chair, eat small amount of slowly, do not smoke, and meeting elimination needs. Thank you.